Well, Kristy, we've discussed the fiscal implications of COVID. If we go to the front page of the Courier, you can very much get an insight into the health implications of a couple of people who have broken the law, and the law has come down very heavily. Enemy of the states, good headline, a real contender for headline of the week. This idiots who defied border rules and put our health at risk. 4 travellers who arrived in Queensland from COVID-ravaged Sydney on a luxury super yacht have been slammed by state leaders and police as the COVID-positive couple who fled Melbourne amid a virus outbreak have been unmasked. Melbourne-based audio-visual technology millionaire Jeremy Young was one of 4 travellers who entered Queensland from Sydney's worsening COVID crisis on a super yacht after making false border declarations before attending a rugby test at Suncorp Stadium. Now, this has been all over the news in Queensland tonight, and these people are deeply, deeply unpopular with the Queensland public. And, of course, the Premier is furious. She's always furious these days, but in particular with this situation.
While we're having a national conversation about supporting people to pay their mortgage and to keep the doors of their business open, and particularly low-skilled workers who feel that they have no other choice but to go to work and perhaps put themselves in environments where they feel unsafe to do so and bring that risk back to their family, we have the other part of the community dealing with the response of jumping on a luxury super yacht, flouting borders and the health response and putting people at risk. It is how the other half live. And these people are not the first people to be busted crossing borders on a luxury super yacht. There was a group of 5 people in Melbourne last year doing exactly the same thing. This must absolutely make people so angry who have lost their job or are thinking they're putting their family at risk by going to work to read this and see this on the news.
Yeah, and I'm sure that the book will be thrown at them. I mean, they're talking about $4,300 fines. Surely we need to look at maybe even something more punitive. You know, a month in the cooler. I mean, maybe that is the disincentive that needs to be thrown at these people. All right, the Adelaide Advertiser, our best shots, the headline. Recruiting more GPs to the vaccination rollout and setting up drive-through jab clinics are our best chance of winning the battle against COVID-19, medical experts say. The AMA estimates fewer than half of the state's GPs offer COVID-19 vaccines, with hundreds of medical practices put off by complex regulations and low payments for administering jabs. I've got to say, Kristy, you know, the confusion around the jab, the vaccination rollout, where you can get it, when you can get it, when you can get AstraZeneca, when you can get Pfizer, you know, when you're actually, you know, qualified to get those particular jabs. I think a lot of the confusion has added to the vaccination hesitancy.
General practitioners are the strongest link to vulnerable cohorts in our community, particularly the elderly and particularly those who have underlying health conditions. They tend to have an ongoing close relationship with a particular GP as opposed to young people who generally do not, because they're not sick that often. GPs needed to be the front line of this from the get-go. Last year, the AMA argued very, very strongly with the government not to have mass vaccinations done through pharmacies because they did not want the Pharmacy Guild encroaching on their turf and that resulting in further access to the Medicare benefits scheme by the Pharmacy Guild. So the government had to work with GPs. The AMA has not been fast enough at corralling GPs to say, this is your duty to the Australian public. This is what you do best. You are the first line of defence to the community. They are the most trusted people in the community. Why they are hesitant to do so, I think, is doing Australia a great disservice.